Why does it hurt in the eyes? Pain in the eyes is often experienced by people who spend most of the time behind the screens of various gadgets. Fatigue of the optic nerve, insufficient production of tear fluid provoke dryness, soreness and other unpleasant sensations. To avoid discomfort in the eyes, ophthalmologists recommend taking regular breaks while working at the computer, as well as performing special eye exercises that relieve tension and strengthen the eye muscles. But if the discomfort does not leave for a long time, you should consult a specialist, as inflammation, injury, infection or allergies can be their cause. Causes of cramps, pain and tearing of the eyes. Pain in the eyes can be short-term or long-term, depending on various reasons. Ordinary fatigue from long work at the computer or getting into the eyes of a foreign body cause temporary discomfort. Relief will come after the removal of the object from the eye or rest. In the event of inflammation, injury, infection, or an allergic reaction, cramps, pain, tearing, and redness will be present all the time, and over time, that discomfort may worsen. One of the causes of pain and burning of the eyes in combination with a headache may be a change in pressure in the fundus, provoked by changes in atmospheric pressure and bad weather. Separately, it is worth mentioning the discomfort due to wearing contact lenses. Insufficient tearing, accompanied by friction of the lens on the eyeball, causes irritation and inflammation. In this case, special drops artificial tears will help. The most common causes of pain in the eyes are foreign body entry, allergic reaction, lack of sleep, infection, injury, overvoltage, pain and dryness in the eyes after sleep, pain and dryness in the eyes after sleep. Soreness and dryness of the eyes in the morning are most often associated with the violation of the production of tear fluid or its low quality. Symptoms such as severe pain from bright lights, gritty sensations, itching and sharp pain after sleep can be evidence of various eye diseases, from infectious diseases to glaucoma, as well as trauma. An ophthalmologist will be able to establish the correct diagnosis. Dry eye syndrome. Dry eye syndrome is considered one of the most common reasons for visiting ophthalmologists. The cause of this disease is insufficient moisturizing with the tear of the eyeball. A tear consists of three components: lipid, water and mucin, produced by certain glands. Violations in the work of these organs and leads to lacrimal insufficiency and dry eyes. Factors contributing to the occurrence of dry eye syndrome. Modern gadgets. Contact lenses. Age aspect, over 50 years old. Menopause. Indoor microclimate. Climatic conditions outside the premises. Frequent airplane flights. Smoking. Certain autoimmune and endocrine diseases. Taking certain medications. Problems with the eyelids, impossibility of complete closure. Refractive surgery on the cornea. A specialist can accurately determine the causes of dry eye syndrome and prescribe the appropriate treatment, but if you feel that your eyes are just tired, rest, exercise and moisturizing drops will help. Treatment and diagnosis of pain in the eyes. Dry eye syndrome. If there is a sharp pain, tearing, redness and other unpleasant symptoms, you should contact an ophthalmologist who will establish a diagnosis and select the correct treatment regimen. Inflammation caused by an infection is successfully treated with antibiotics, which are aimed at destroying the disease-causing pathogen. Discomfort associated with the foreign body disappears after its removal from the eye and subsequent treatment with healing agents. Eye soreness can be triggered by vascular diseases, poor nerve conduction and migraines, which cause spasms and fatigue of the nerves of the eyeball. If eye problems are accompanied by frequent dizziness, weakness, nausea, and general malaise, it may be worth paying attention to blood pressure and monitoring it until the symptoms pass. Cramps and pain also occur due to eye trauma, including contact lenses. Depending on the type of injury, appropriate treatment is prescribed. In the case of diagnosing dry eye syndrome, moisturizing drops are prescribed. The so-called artificial tear and the factors that cause this disease are eliminated. Vitamin complexes containing lutein, zeaxanthin, and blueberries contribute to the maintenance of eye health. Leekberry blueberry paste is very popular. It is produced using a unique technology and contains even more antioxidants than just berries. Blueberry paste has a wonderful natural taste, helps with myopia, vascular disorders, cataracts and glaucoma, is used after meals or as a healthy snack. Folk remedies to combat eye discomfort. Dry eye syndrome. Folk remedies will help eliminate inflammation and eye fatigue. Compresses from birch leaves, sage, chamomile, as well as tea leaves. Black tea lotions. This method effectively eliminates redness, relieves swelling and reduces eye strain. Use only black tea without additives and flavorings. It needs to be boiled and chilled. Then dip cotton pads into the liquid, squeeze lightly so that the disc is moistened, and put on closed eyelids. Leave lotion on for 5–10 minutes. When repeating the procedure, be sure to use new cotton pads. Birch leaf compress. Add a handful of birch leaves to 200 milliliters of boiling water, cook for 2–3 minutes. Cool, blot 2 cotton pads and put them on closed eyes. Sage decoction. Fill small cloth bags with dried sage, dip them in milk at room temperature. Place the bags over closed eyes for 15 minutes. After the procedure, wash your face with cool water. Chamomile infusion. Mix chamomile in equal proportions with mint leaves and the top of the dill stem. Pour boiling water over everything, leave for 30 minutes. Moisten cotton pads with the resulting solution and put on your eyes for 5 minutes. Prevention of the appearance of pain in the eyes. Dry eye syndrome. To avoid pain, burning, redness, dryness and other manifestations of eye discomfort, experts recommend following these rules. When working at a computer, you need to take breaks, exercise for the eyes, use moisturizing drops and gels, and go out into the fresh air. Observe eye hygiene, as well as sleep patterns. Do not sit up at the computer late at night. Use drops and other pharmacy eye products only on the recommendation of an ophthalmologist. Check the expiration date of cosmetics that are in direct contact with the eyes, cream, mascara, eyeshadow. Try to avoid foods that cause you allergies. Eye health largely depends on simple factors: a balanced diet, regular intake of vitamins, adherence to eye care rules, work and rest schedules, but for serious symptoms, always consult a specialist.